Hepatitis A. Hepatitis A will be a profoundly infectious liver contamination brought about by the hepatitis A infection. The infection is one of a few kinds of hepatitis infections that reason irritation and influence your liver's capacity to work. You're destined to get hepatitis A from tainted food or water or from close contact with an individual or article that is contaminated. Gentle instances of hepatitis A don't need treatment. A great many people who are tainted recuperate totally with no lasting liver harm. Rehearsing great cleanliness, including washing hands regularly, is probably the most ideal approaches to ensure against hepatitis A. Immunizations are accessible for individuals most in danger. Manifestations. Hepatitis A signs and manifestations ordinarily don't show up until you've had the infection for half a month. Be that as it may, not every person with hepatitis A creates them. In the event that you do, hepatitis signs and side effects can include weariness, unexpected sickness and regurgitating, stomach agony or inconvenience, particularly on the upper right side underneath your lower ribs, by your liver, earth-shaded solid discharges, loss of hunger, second-rate fever, dull pee, joint agony, yellowing of the skin and the whites of your eyes, jaundice, extraordinary tingling. These side effects might be generally gentle and disappear in half a month. Here and there, nonetheless, hepatitis A disease brings about a serious ailment that keeps going a while. When to see a specialist. Cause a meeting with your primary care physician in the event that you have signs or manifestations of hepatitis A. Getting a hepatitis A immunization or an infusion of immunoglobulin, a neutralizer, inside about 14 days of openness to hepatitis A may shield you from contamination. Ask your primary care physician or your nearby well-being office about getting the hepatitis A antibody if you've gone out of the nation as of late, especially to Mexico or South or Central America, or to territories with helpless sterilization. An eatery where you as of late ate reports a hepatitis A episode. Somebody near you, like a flatmate or parental figure, is determined to have hepatitis A. You as of late had sexual contact with somebody who has hepatitis A. Causes. Hepatitis A is brought about by an infection that taints liver cells and causes aggravation. The irritation can influence how your liver functions and cause different signs and side effects of hepatitis A. The infection most regularly spreads when you eat or drink something defiled with fecal matter, even little sums. It doesn't spread through sniffling or hacking. Here are a portion of the particular ways the hepatitis A infection can spread. Eating food took care of by somebody with the infection who doesn't completely wash their hands in the wake of utilizing the latrine. Drinking defiled water. Eating crude shellfish from water contaminated with sewage. Being in close contact with an individual who's tainted, regardless of whether that individual has no signs or indications. Engaging in sexual relations with somebody who has the infection. Hazard factors. You're at expanded danger of hepatitis A in the event that you travel or work in spaces of the reality where hepatitis A is normal. Go to youngster care or work in a kid care focus. Live with someone else who has hepatitis A. Are a man who has sexual contact with different men. Have any sort of sexual contact with somebody who has hepatitis A. Are HIV positive. Are encountering vagrancy. Have a coagulating factor issue, like hemophilia. Utilize any sort of illicit medications, not simply those that are infused. Difficulties. In contrast to different sorts of viral hepatitis, hepatitis A doesn't cause long-haul liver harm, and it doesn't get constant. In uncommon cases, hepatitis A can cause an abrupt loss of liver capacity, particularly in more seasoned grown-ups or individuals with persistent liver infections. Intense liver disappointment requires a stay in the emergency clinic for observing and therapy. A few group with intense liver disappointment may require a liver transfer. Avoidance. The hepatitis A antibody can forestall contamination with the infection. The immunization is normally offered in 2 chances. The first is trailed by a promoter shot a half-year later. The Centers for Disease Control and Prevention suggests a hepatitis A antibody for the accompanying individuals. All kids at age 1, or more established kids who didn't get the youth antibody. Anybody age 1 year or more established who is encountering vagrancy. Babies ages 6 to 11 months voyaging universally. Family and parental figures of adoptees from nations where hepatitis A is normal. Individuals in direct contact with other people who have hepatitis A. Lab laborers who may interact with hepatitis A. Men who have intercourse with men. Individuals who work or travel in pieces of the reality where hepatitis A is normal. Individuals who utilize any sort of illegal medications, not simply infused ones. Individuals with thickening variable issues. Individuals with persistent liver infection, including hepatitis B or hepatitis C. Anybody wishing to acquire security, invulnerability. In case you're worried about your danger of hepatitis A, inquire as to whether you ought to be inoculated. Follow security safeguards when voyaging. In case you're making a trip to parts of the existence where hepatitis A flare-ups happen, find these ways to forestall contamination. Strip and wash every single new products of the soil yourself. Try not to eat crude or half-cooked meat and fish. Drink filtered water and use it when brushing your teeth. Stay away from all refreshments of obscure virtue, with or without ice. Whenever filtered water isn't free, bubble faucet water prior to drinking it. Practice great cleanliness. Altogether, wash your hands frequently, particularly subsequent to utilizing the latrine or changing a diaper and prior to getting ready food or eating.